18 signs of diabetes on the skin that few people know. Did you know that your skin can reveal important signs about your body's health? What if you could identify early signs of diabetes simply by observing subtle changes in your skin? In this video, we will explore 18 skin signs of diabetes that few people know about but can be crucial for early diagnosis and better management of the condition. Have you ever noticed dark spots, frequent infections, or changes in skin texture? Could these changes be related to diabetes? How can you treat and prevent skin complications associated with this disease? Stay with us to discover how your skin can be a powerful indicator of your health and learn effective strategies to care for it. And stay until the end because sign 17 is the most dangerous. Many people have it and don't know it. Let's get started. What happens to your body when you have diabetes? When you have diabetes, your body struggles to regulate blood glucose levels. This happens because the pancreas does not produce enough insulin or because the body's cells do not respond properly to insulin. Insulin is an essential hormone that helps glucose enter the cells, where it is used for energy. As a result, glucose builds up in the blood, leading to high blood sugar levels, hyperglycemia. Over time, this condition can damage various organs and systems. What are the consequences if you don't treat it or make changes? If you don't treat diabetes or make changes, you may face serious complications such as heart disease, stroke, kidney failure, vision loss, neuropathy, nerve damage, and circulatory problems that can lead to limb amputations. Additionally, persistent hyperglycemia can weaken the immune system, increasing the risk of infections. Proper management is essential to prevent these consequences and maintain quality of life. What tests should I take to identify diabetes? To identify diabetes, take the following tests. Fasting blood glucose measures glucose level after fasting. Glycated hemoglobin test, HbA1c, shows average glucose levels over the past 2 to 3 months. Oral glucose tolerance test measures the body's response to glucose ingestion. Random blood glucose test. 18 signs of diabetes on the skin that few people know. 1. Dark spots on the skin. What they are and how to treat them. Acanthosis nigricans is a condition characterized by dark, thick patches of skin, usually with a velvety texture. These patches often appear in body folds such as the neck, armpits, groin, knees, and elbows. Acanthosis nigricans is frequently associated with insulin resistance, a common precursor of type 2 diabetes. High insulin levels in the blood can lead to the overgrowth of skin cells, resulting in dark spots. Besides being an indicator of insulin resistance, acanthosis nigricans can occur in overweight or obese individuals and is more common in people of African, Hispanic, or indigenous descent. Although acanthosis nigricans does not cause physical discomfort, it can be aesthetically displeasing and cause psychological concerns. Treating acanthosis nigricans involves addressing the underlying condition, often insulin resistance. Weight loss, dietary improvement, and increased physical activity are recommended measures to reduce insulin levels and, consequently, the dark spots. In some cases, topical treatments like depigmentation creams can be used to lighten the spots. However, any treatment should be supervised by a doctor to ensure effectiveness and safety. 2. Bacterial infections. How diabetes makes your skin vulnerable. Bacterial infections are more common in people with diabetes due to a compromised immune system and high blood glucose levels, which provide a favorable environment for bacterial growth. Common types of bacterial infections in diabetics include boils, infections of hair follicles, folliculitis, cellulitis, and carbuncles. Boils are painful infections of hair follicles and sebaceous glands, resulting in red, swollen nodules on the skin, often filled with pus. Cellulitis is a bacterial infection of the deeper layers of the skin and underlying tissues, causing swelling, redness, pain, and warmth in the affected area. If left untreated, cellulitis can spread rapidly and lead to severe complications. People with diabetes should be particularly vigilant for any signs of skin infection and seek immediate medical attention for proper treatment, usually involving antibiotics. Preventing bacterial infections involves maintaining good personal hygiene, properly caring for cuts and scratches, and controlling blood glucose levels to strengthen the immune system. Additionally, it is essential for people with diabetes to have regular checkups with their doctor to monitor overall health and detect any signs of infection or other complications early. 3. Fungal infections. Protect your skin from fungi. Fungal infections are common in people with diabetes due to high blood glucose levels, which favor fungal growth. Candidiasis, caused by the fungus Candida, is one of the most frequent fungal infections among diabetics. Candidiasis can affect various body areas, including the mouth, oral thrush, nails, skin, and moist areas such as skin folds, armpits, groin, and under the breasts. Symptoms of candidiasis include redness, itching, burning, and the presence of white lesions or plaques in the affected area. Tinea pedis, or athlete's foot, is another common fungal infection that usually affects the skin between the toes, causing peeling, cracking, and itching. Tinea cruris, or jock itch, affects the groin area, resulting in a red, itchy rash. Treating fungal infections typically involves using antifungal creams or ointments, and in more severe cases, oral antifungal medications may be necessary. Preventing fungal infections includes keeping the skin clean and dry, especially in body folds, wearing loose-fitting cotton clothing, avoiding staying in wet clothes for long periods, and controlling blood glucose levels. Additionally, it is important for people with diabetes to have regular checkups and report any signs of fungal infection to their doctor for appropriate treatment. 4. Diabetic dermopathy. Identify and treat brown spots. Diabetic dermopathy is a skin condition that occurs in people with diabetes, characterized by small brown or red spots that develop on the skin, usually on the shins. These spots are painless, scaly, and may resemble age spots or bruises. The exact cause of diabetic dermopathy is not fully understood, but it is believed to be related to changes in small blood vessels due to inadequate blood glucose control. Although diabetic dermopathy is generally harmless and does not cause significant symptoms other than skin spots, its presence may indicate circulation problems and an increased risk of other diabetic complications. There is no specific treatment for diabetic dermopathy, but keeping blood glucose levels under control can help prevent the appearance of new spots and improve overall skin condition. Additionally, it is important to protect the skin on the legs from injuries and trauma, as skin affected by diabetic dermopathy may be more susceptible to damage. Using moisturizers can help keep the skin soft and prevent dryness, which can exacerbate the condition. Consulting a dermatologist may be beneficial for people with diabetic dermopathy, as they can provide guidance on skin care and identify other possible skin complications related to diabetes. 5. Necrobiosis Lipoidica Diabeticorum, NLD. What you need to know. Necrobiosis Lipoidica Diabeticorum, NLD, is a rare skin condition that primarily affects people with diabetes, especially women. NLD is characterized by yellow-red patches or plaques that develop on the skin, usually on the shins. These lesions may be shiny, with raised borders and a central area that is paler and atrophic. In some cases, the lesions can become ulcerated and painful, especially if trauma occurs in the affected area. The exact cause of NLD is not well understood, but it is believed to be related to changes in small blood vessels and inflammation. Although NLD can occur in anyone, it is more common in people with long-standing diabetes and poor blood glucose control. Treating NLD can be challenging. Maintaining good glycemic control is essential to prevent the condition's progression. Topical creams, such as corticosteroids, may be prescribed to reduce inflammation. In more severe cases, treatments such as phototherapy or corticosteroid injections may be considered. Protecting the affected area from trauma is crucial to avoid ulcers and infections. Patients with NLD should be followed by a dermatologist to monitor the condition and adjust treatment as needed. NLD may be a sign of broader diabetic complications, so it is important for patients to also work with their endocrinologist to optimize diabetes management. 6. Diabetic blisters. Causes, symptoms, and treatments. Diabetic blisters, or bullosis diabeticorum, are a rare manifestation of diabetes, characterized by the spontaneous formation of blisters on the skin. These blisters are painless, vary in size, and can appear on areas such as the fingers, toes, feet, legs, and forearms. Although they may look severe, diabetic blisters usually do not come with inflammation or redness around them and resemble blisters caused by burns. The exact cause of diabetic blisters is not fully known, but they are believed to be related to diabetic neuropathy and microangiopathy, which are diabetes complications affecting nerves and small blood vessels, respectively. The blisters can appear without any apparent trauma and typically disappear on their own in a few weeks, without leaving significant scars. Treating diabetic blisters involves basic skin care to prevent infections. Keeping the area clean and covered with a sterile gauze can help protect the blisters while they heal. Avoiding popping the blisters is crucial, as this can increase the risk of infection. If signs of infection, such as redness, swelling, or pus, appear, it is important to seek medical attention immediately. To prevent diabetic blisters, it is essential to maintain good blood glucose control and take good care of the feet and other areas prone to diabetic complications. People with diabetes should perform regular foot exams and consult a doctor to monitor and manage any skin problems or other complications related to diabetes. 7. Eruptive xanthomas. Small bumps that should be taken seriously. Eruptive xanthomas are small yellow nodules that appear on the skin, usually accompanied by a red halo. These nodules often appear suddenly and can be scattered over the arms, legs, buttocks, and back. Eruptive xanthomas are associated with elevated triglyceride levels in the blood, a condition often found in people with uncontrolled diabetes, especially type 2 diabetes. Eruptive xanthomas are caused by the buildup of lipids in the skin tissues. In addition to diabetes, this condition can occur in people with familial hyperlipidemia or other metabolic disorders that result in high blood fat levels. While the xanthomas themselves do not cause pain, they can cause itching and discomfort, and their appearance can be aesthetically concerning for patients. Treating eruptive xanthomas primarily involves reducing blood triglyceride levels. This can be achieved through dietary changes, such as reducing the intake of saturated fats and refined sugars, and increasing the consumption of fiber and omega-3 fatty acids. Additionally, regular physical exercise and weight loss can help improve lipid profiles. In some cases, lipid-lowering medications may be prescribed by the doctor to help control blood lipid levels. Controlling blood glucose levels is also crucial to prevent the formation of new xanthomas and promote the resolution of existing ones. People with diabetes should work closely with their endocrinologist and nutritionist to develop a comprehensive management plan that includes diet, exercise, and, if necessary, medications. 8. Granuloma annulare. Identifying red rings on the skin. Granuloma annulare is a skin condition that manifests as arcs or rings of red, raised, firm lesions on the skin. These lesions are usually found on the hands, feet, elbows, and ankles. Although the exact cause of granuloma annulare is not well understood, it is more common in people with diabetes, suggesting a possible link with the immune system and blood glucose levels. Granuloma annulare can be asymptomatic, but in some cases, it can cause itching or tenderness. The lesions can vary in size and number and can disappear spontaneously without treatment within a few months to years. However, in persistent or widespread cases, treatment may be necessary to improve the skin's appearance and the patient's comfort. Treatment of granuloma annulare may include the application of topical corticosteroid creams or ointments to reduce inflammation. In more severe cases, corticosteroid injections directly into the lesions may be administered. Other possible treatments include phototherapy, immunosuppressive medications, and ultraviolet light therapy. Maintaining good blood glucose control can also help prevent the occurrence of granuloma annulare in people with diabetes. Patients with granuloma annulare should be followed by a dermatologist to monitor the condition and adjust treatment as needed. While granuloma annulare is not directly associated with serious complications, it can be an indicator of inadequate diabetes control and should be treated as part of a comprehensive health management plan. 9. Dry and itchy skin. Relief and prevention for diabetics. People with diabetes often face problems of dry and itchy skin. This condition can be attributed to several diabetes-related factors, including diabetic neuropathy, which affects the nerves and can alter the sensation of itching and pain, and poor blood circulation, which can result in less moisture reaching the skin. Additionally, high blood glucose levels can lead to fluid loss, contributing to skin dehydration. Dry and itchy skin can cause significant discomfort and increase the risk of infections, as excessive scratching can lead to skin breaks and cracks, which can serve as entry points for bacteria. Preventing dry skin involves maintaining good hydration, both by drinking enough water and by regularly applying moisturizers. Using fragrance-free and hypoallergenic moisturizers is recommended to minimize irritation. Taking short showers with warm rather than hot water and using mild soaps can help preserve the skin's natural oils. Additionally, avoiding irritating clothing and using humidifiers in dry environments can help keep the skin hydrated. Controlling blood glucose levels is also crucial, as high levels can exacerbate skin dehydration. If dry and itchy skin persists or shows signs of infection, it is important to seek medical attention. The doctor may prescribe medicinal creams or recommend other treatments to relieve symptoms and prevent complications. Maintaining a regular skin care routine is essential for people with diabetes, helping to keep the skin healthy and reduce the risk of skin problems. 10. Slow wound healing. Understand the risks and necessary care. Slow wound healing is a common concern for people with diabetes, due to factors such as poor blood circulation, neuropathy, and high blood glucose levels. Poor circulation prevents essential oxygen and nutrients from reaching wounded areas, slowing the healing process. Diabetic neuropathy can reduce sensation, making small wounds go unnoticed and become more severe over time. Additionally, high blood glucose levels can negatively affect white blood cell function, which is crucial for fighting infections. This makes wounds more susceptible to infections, which can further complicate the healing process. The combination of these factors means that even minor cuts or scratches can turn into serious problems if not properly cared for. To improve wound healing, it is crucial to maintain good blood glucose control. Proper wound care, cleaning them regularly and applying appropriate dressings, is essential to prevent infections. Keeping the skin clean and dry, and protecting wounded areas from further trauma, is also important. People with diabetes should perform regular foot exams and other areas prone to injuries and seek immediate medical attention at the first sign of infection, such as redness, swelling, warmth, or pus. In cases of severe or non-healing wounds, specialized treatments, such as hyperbaric oxygen therapy or surgical interventions, may be necessary. Working closely with a healthcare team, including endocrinologists and podiatrists, is essential to effectively manage wound healing in people with diabetes. 11. Thick skin. How diabetes can change your skin's texture. Thick skin, also known as diabetic scleroderma, is a condition that can affect people with diabetes, characterized by hardening and thickening of the skin. This condition usually affects the upper back, neck, shoulders, and occasionally other body areas. The skin can become stiff, waxy, and difficult to move, which can restrict joint movements and cause discomfort. Diabetic scleroderma is associated with poor blood glucose control and is more common in people with long-standing diabetes. The exact cause of this condition is not fully understood, but it is believed to be related to changes in blood vessels and connective tissues due to high glucose levels. Treating thick skin primarily involves maintaining good glycemic control to prevent the condition's progression. In addition to glycemic control, regularly moisturizing the skin with emollients can help keep it soft and flexible. In some cases, physical therapy may be recommended to improve the mobility of affected joints. Stretching and strengthening exercises can also help maintain joint function and reduce discomfort associated with thick skin. If thick skin becomes severe or causes significant problems, it is important to consult a dermatologist or diabetes specialist for further guidance. In some cases, more intensive treatments, such as phototherapy or immunosuppressive medications, may be necessary. Diabetic scleroderma can be a sign of broader diabetic complications, so a comprehensive approach to health management is essential. 12. Leg and foot swelling. How to relieve edema in diabetics. Swelling in the legs and feet, also known as edema, is a common problem in people with diabetes. This swelling can be caused by various reasons, including poor circulation, fluid retention, kidney problems, and heart failure, all of which are potential complications of diabetes. Diabetic neuropathy can also contribute to swelling, as nerve damage can affect the body's ability to regulate fluids properly. Edema can range from mild to severe and may be accompanied by other symptoms such as pain, a feeling of heaviness in the legs, and stretched or shiny skin. Prolonged swelling can increase the risk of infections and ulcers, especially if there are open wounds on the skin. Therefore, it is crucial for people with diabetes to monitor their feet and legs regularly and take steps to control the swelling. Treating edema involves identifying and addressing the underlying cause. Maintaining good blood glucose control is fundamental. Additionally, elevating the legs when possible, wearing compression stockings, and avoiding prolonged sitting or standing can help reduce swelling. Reducing salt intake in the diet can also be beneficial to minimize fluid retention. In severe cases, diuretic medications may be prescribed to help remove excess fluids from the body. However, These medications should be used under medical supervision, as they can have side effects and interactions with other medications. Regularly consulting a doctor is essential to monitor and manage edema, as well as to detect and treat any underlying complications. 13. Skin color changes. Warning signs for diabetics. Skin color changes can occur in people with diabetes due to a variety of factors. Poor circulation, often associated with diabetes, can cause skin discoloration, particularly in the extremities, such as the feet and legs. The skin may become darker, especially in body folds such as the neck, armpits, and groin, a condition known as Acanthosis nigricans. Additionally, high blood glucose levels can affect skin pigmentation, resulting in dark spots or hyperpigmentation. Another common change is the presence of brown, scaly, and round spots on the legs, known as diabetic dermopathy. These spots are caused by changes in small blood vessels and are an indicator of diabetic microvascular complications. Necrobiosis Lipoidica Diabeticorum, NLD, a rarer condition, can also cause yellow-red spots on the shins, which can become atrophic and shiny. Treating skin color changes primarily involves controlling blood glucose levels to prevent the progression of skin conditions. Additionally, keeping the skin well moisturized and protected from trauma can help minimize pigmentation changes. Using sunscreen regularly is also important to protect the skin from further damage caused by UV rays. Consulting a dermatologist can be helpful to determine the exact cause of skin color changes and to receive appropriate treatment guidance. In some cases, topical creams such as bleaching creams or corticosteroids may be prescribed to treat hyperpigmentation or inflammation. Early detection and treatment of skin color changes can help prevent further complications and improve the appearance and overall health of the skin. 14. Corns and calluses. Prevention and effective treatment for diabetics. Corns and calluses are thickened areas of skin that develop in response to repeated pressure or friction and are common in people with diabetes, especially on the feet. Due to diabetic neuropathy, which can decrease sensitivity in the feet, diabetics often do not notice the initial signs of excessive pressure, resulting in the development of corns and calluses. Additionally, poor blood circulation can slow healing and increase the risk of ulceration under these hardened areas. Corns are thickened, hardened areas of skin that typically form on bony parts of the feet, such as under the toes or heels. Calluses are broader, flatter areas of hardened skin that usually appear on the soles of the feet. While corns and calluses themselves are not dangerous, they can become a serious problem for people with diabetes as they can hide ulcers or wounds that can easily become infected. Treating corns and calluses involves reducing pressure on the affected areas and keeping the skin moisturized. Wearing orthopedic insoles and properly fitting shoes can help distribute pressure evenly and prevent the formation of new hardened areas. Removing corns and calluses should be done carefully. It is recommended that this be done by a healthcare professional, such as a podiatrist, to avoid accidental cuts and infections. Maintaining good blood glucose control is essential to promote healing and prevent complications. People with diabetes should examine their feet daily to identify early signs of corns, calluses, or other changes and seek medical advice for proper management. Preventing and effectively treating corns and calluses can help avoid serious complications and maintain foot health. 15. Charcot foot. Understand this severe diabetes complication. Charcot foot, or Charcot arthropathy, is a severe diabetes complication that affects the bones, joints, and soft tissues of the feet and ankles. This condition is characterized by inflammation, joint instability, and, in severe cases, significant deformities. Charcot foot occurs due to peripheral neuropathy, which causes loss of sensation in the feet, allowing microfractures and injuries to go unnoticed and worsen over time. The early signs of Charcot foot include swelling, redness, and warmth in the feet, often without significant pain due to neuropathy. If left untreated, Charcot foot can lead to severe deformities such as the collapse of the foot arch, resulting in a condition known as rocker bottom foot. These deformities increase the risk of ulcers, infections, and, in extreme cases, amputations. Early diagnosis of Charcot foot is crucial to prevent serious complications. Imaging tests such as X-rays and MRIs can be used to assess the extent of the damage. Initial treatment typically involves immobilizing the affected foot with a cast or orthosis to prevent further damage and allow healing. Weight-bearing may need to be completely or partially avoided for several months. In advanced cases, Surgical interventions may be necessary to correct deformities and stabilize the foot. Maintaining strict blood glucose control is essential to promote healing and prevent the condition's progression. People with diabetes should have regular foot exams and seek immediate medical attention at the first sign of problems to minimize the risk of developing Charcot foot and other severe complications. 16. Diabetic hand syndrome. How to recognize and treat. Diabetic hand syndrome, also known as diabetic chiroarthropathy, is a condition where the hands become stiff and the skin appears thick and waxy. This condition affects the mobility of finger joints, making it difficult to fully bend or extend the fingers. Diabetic hand syndrome is associated with poor blood glucose control and is more common in people with long-standing diabetes. Early symptoms may include the inability to fully press the palms together, prayer sign, followed by thickening of the skin on the hands and fingers. Over time, the condition can progress, resulting in hand deformities and significant limitation of manual function. The exact cause of diabetic hand syndrome is not fully understood, but it is believed to be related to the accumulation of advanced glycation end products, AGEs, in tissues, which affect the elasticity of the skin and tendons. Treating diabetic hand syndrome involves primarily strict blood glucose control to prevent the condition's progression. Physical therapy and stretching exercises can help maintain joint mobility and reduce stiffness. In some cases, the use of orthoses may be recommended to support the hands and improve function. Keeping the skin well moisturized with emollients can help minimize skin thickening. In more severe cases, medical interventions such as corticosteroid injections or immunomodulatory therapies may be considered. It is important for people with diabetes to have regular checkups and work closely with their doctor to monitor and manage diabetic hand syndrome and other complications associated with diabetes. 17. Itchy papules. Small red bumps that itch. Itchy papules are small, red, itchy bumps that can appear on the skin of people with diabetes. These papules are often caused by a condition known as diabetic pruritus, which is related to diabetic neuropathy and poor blood glucose control. Poor circulation and nerve damage can alter the sensation of itching and pain, resulting in intense and persistent itching. Itchy papules can appear anywhere on the body but are most common on the extremities such as arms, legs, and trunk. Repeated scratching of the affected areas can lead to skin lesions, increasing the risk of secondary infections. The condition can cause significant discomfort and negatively impact the patient's quality of life. Treating itchy papules involves strict blood glucose control to reduce neuropathy symptoms and improve overall skin health. Topical creams such as corticosteroids and antihistamines can be used to relieve itching and reduce inflammation. Keeping the skin well moisturized with lotions and emollient creams can also help minimize itching. Additionally, it is important to avoid irritating clothing and use soft, breathable fabrics to reduce friction on the skin. In persistent or severe cases, systemic medications such as tricyclic antidepressants or anticonvulsants may be prescribed to help control neuropathy and itching. Consulting a dermatologist can be helpful to develop an appropriate treatment plan and monitor the condition. Early detection and treatment of itchy papules can help prevent further complications and improve patient comfort. 18. Foot cracks. Prevention and treatment of painful cracks. Foot cracks are deep cracks in the skin that can occur in people with diabetes, primarily on the heels and between the toes. These cracks are often caused by dry and thick skin, which is common in diabetics due to neuropathy and poor circulation. Lack of moisture in the skin can cause it to lose elasticity, resulting in painful cracks that can bleed and easily become infected. Foot cracks can be exacerbated by wearing improper shoes that cause friction or excessive pressure on specific areas of the feet. Walking barefoot on hard surfaces can also contribute to the development of cracks. The presence of diabetic neuropathy can reduce sensitivity in the feet, causing small cracks to go unnoticed and worsen over time. Treating foot cracks involves keeping the skin well moisturized with emollient creams and oils to prevent dryness and improve skin elasticity. It is important to avoid using products that contain alcohol or fragrances, as they can further dry out the skin. Wearing comfortable, well-fitting shoes can help reduce pressure and friction on the feet. In severe cases, where the cracks are deep and painful, it may be necessary to seek medical attention. A podiatrist can carefully remove the thick skin around the cracks and recommend additional treatments such as antibiotic ointments to prevent infections. Maintaining good blood glucose control is crucial to promote healing and prevent the formation of new cracks. Prevention is key to avoiding foot cracks. People with diabetes should inspect their feet daily to detect early signs of cracks or other changes and take immediate steps to treat and protect the skin. How to prevent diabetes? To prevent diabetes, follow these tips. 1. Maintain a healthy diet. Prioritize fiber-rich foods, vegetables, fruits, and whole grains while avoiding foods high in sugar and saturated fats. 2. Exercise regularly. Activities like walking, running, swimming, or cycling help control weight and improve insulin sensitivity. 3. Control your weight. Maintaining a healthy weight significantly reduces the risk of type 2 diabetes. 4. Avoid smoking. Smoking increases the risk of diabetes and other chronic diseases. 5. Limit alcohol consumption. Drink in moderation, as alcohol can affect blood glucose levels. 6. Monitor your health. Have regular checkups to monitor blood glucose levels, especially if you have a family history of diabetes. 7. Manage stress. Techniques like meditation, yoga, and breathing exercises can help reduce stress, which can negatively impact health. By following these practices, you can significantly reduce the risk of developing diabetes. Thank you for watching. Don't forget to subscribe to the channel. I wish you great health, wealth, and happiness. See you in the next video.